Well, thanks for coming. Appreciate you coming to our booth and hearing a little bit about our new lens called UltraHealth. And we're very excited about the UltraHealth lens. It's a whole new paradigm shift, we believe, in irregular cornea lens fitting. It's a product that I think can really make a huge difference for you and your irregular cornea practice, especially for your keratoconic patients, and I'm going to tell you why here today. I am Dr. Jim Kirchner, practiced 34 years in private practice. I've been in the industry now for about 3 years, and I'm just having a really good time with SynergEyes back home fitting contact lenses, and this has just been very exciting for me to be able to be a part of this company and be able to bring some new products to our industry, to our colleagues, so that we can do better work for our patients. Let me tell you a little bit about UltraHealth. As I said before, it really is a significantly different lens. We have created a lens that has high oxygen permeability. It, of course, is a dual material lens, but we've got a high DK RGP lens in the center with a silicone hydrogel skirt now that's also high DK. And we believe with the materials and now the design of how the lens fits, we've got a lens that can really work tremendously for your patients, especially with keratoconus. It's going to deliver comfortable fit. It's going to be a fit that the patient will be able to wear, should be able to wear all day long. It's going to be very healthy. We're promoting great tear exchange under the lens, but also a tremendously comfortable lens as well. The UltraHealth design is a similar design for those of you that have fit clear cone. There is a similarity, and that similarity is we are using reverse geometry, which was introduced with clear cone. So we still have reverse geometry, we're fitting the vault system. But that's the last of the comparison with clear cone because we have adjusted so many other things. As I mentioned before, the materials are different. We're going to talk about the advantages there, but also the design of how the lens fits on your patient's eye has dramatically changed. So I want you to start thinking about the difference of fitting these lenses compared to your clear cone, because I'm going to change your mindset. You have to be willing and understanding of why you can use the advantages of this lens to be successful, but it's going to be different than clear cone. So we'll go through that in a second. Of course, the beauty of our lens is that we have an RGP center that we can do a lot with, including reverse geometry. Vision's great. We can get over the top of corneal irregularities, but we can hold that RGP in place because of the soft silicone skirt. And that's the beauty of the design, to be able to keep that RGP in place for best vision, best comfort, just best performance of that lens. It comes in 11 different volts, a 50 to a 550 micron volt, also in 3 different skirts. But you're going to find out, and I'm going to talk more about it in just a little bit, that you're primarily going to be using flat skirts. So start thinking flat skirts. I know those of you, again, that we're talking that are using our clear cone, which is a wonderful lens, but you've been used to kind of using more steep skirts, maybe medium skirts. Again, a big reverse on thinking about flat skirts. We've really worked hard on the design of the lens. For volts under 300, we hold the lift curve consistent. Now, first of all, even that curve is twice the steepness of what you were used to in clear cone. So we are automatically, with UltraHealth, opening up that lens. It's huge. It's very important when you're fitting bigger keratoconus patients or cones that are decentered. You're going to find that where you couldn't get success with clear cone, you're going to find success here, I do believe. But when we did see that when we were designing lenses, when we got up to about 300, we could even open it up further by now changing the lift zone or the lift curve and really lift that lens up internally, and it's worked very, very well. So that's the beauty of this lens. In addition to that, when we start talking about the silicone skirt, yes, it's made out of silicone hydrogel, but the design, you're going to see that we've improved the design of the lens, of the skirt itself, to create what we call the outer landing zone. And I'll explain the outer landing zone in just a few minutes because it's critical to your understanding. Let's just look at some of the characteristics. The RGP itself, with clear cone, we were at HDS 100, which is 100 DK. It's great DK. But with the UltraHealth lens and with our Duet lenses, they're the same material, both products, we have a DK in the center now of 130. That's a lot of oxygen transmission. So oxygen to the cornea, especially with this irregular cornea patients, is critical, as we all know, and you're going to get a lot of oxygen transmission with that DK 130. Another thing that we've added with the UltraHealth is the UV blocking abilities, UVA, UVB blocking, which we didn't have before. And another critical thing for you to know is that we've increased the modulus. Now that sounds counterintuitive. We all know as fitters that when you increase the DK of an RGP, usually the modulus goes down, so the lens gets softer. We were able to design a lens material in our polymer that we actually have increased the modulus, so it's a stiffer lens. It doesn't bend as much. So that's great for the UltraHealth. It's great for the Duet lenses. You're not going to see as much lens flexure at all, even though it's a DK of 130. The soft skirt, a tremendous improvement. The clear cone is a HEMA skirt with a 9.3 DK. And now look, our UltraHealth with a silicone hydrogel skirt is an 84 DK. Oxygen transmission is tremendous with these lenses. So let's talk a second about this skirt design that I say is so critical. If you walk away from this presentation with only one remembrance in your mind, it should be about the skirt, because the skirt, this is critical. What we've done compared to, this is a clear cone on top. This is the RGP portion, and here's the skirt of the clear cone. And see how the thickness stays the same on that skirt, and it's made out of HEMA. Well, we were using the whole skirt of the clear cone to adjust the fit of the contact lens itself, to maybe lift and move that the RGP button. With UltraHealth, we don't do that. It has a silicone hydrogel skirt. That isn't intended to be a lifting mechanism to adjust the fit. We use the vaults to adjust the fit for that cone or for that irregular cornea. The skirt is only a minor adjustment, maybe to get better tear circulation under it. That's all, and I'm going to show you what that means in a second. We have thickened, the new design is that we've thickened the soft lens skirt on the outer side of the junction. And what that creates is a new landing zone here compared to that whole skirt, a new landing zone that's narrower than that whole skirt, but it really does provide some lift, some wonderful lift. And it opens up on the other side so that tears can get under the lens very easily. We don't get seal off. We've also adjusted and widened the inner landing zone of the RGP. So if you put the two together, we have a much wider landing zone. Therefore, the comfort is tremendous with these lenses compared to a clear cone, because a clear cone really only sat on one point with the RGP. And those of you who are fitting clear cone, did you get some seal off? You did once in a while. It's not going to happen with these lenses when they're fit properly. It really won't. But in order for that to work properly, a flat skirt is needed, because that, as you flatten that skirt, you're allowing this outer landing zone to do its work. When you try to steepen them, you're almost trying to lift that outer landing zone off the cornea. It'll come crashing back down. So then you've got a tighter fit. So I know it's not easy to think about, but think about flat skirts, flat skirts, flat skirts with these lenses, and you're going to have tremendous success. So let's talk about our lens fitting. It's very simple to fit UltraHealth lenses, so it's going to empower you to fit your cones and your other irregular cornea patients. If you've been a little leery of that in the past, I think with these lenses you're really going to feel confident that you can get this done and take care of those patients' needs in a much more dramatic way than you have in the past. You only have to think about the vault, and that's the key. The vault adjustment is what we're using to clear the cornea, not the skirts, the vault. The vault is what you're using to clear that cornea. The skirt curve is used as just a final adjustment only. And then, of course, the lens power. When you have these three determined, you order them, and you're going to find success. Let's first talk a little bit about putting that lens in. Those of you that fit clear cone, it's much the same. You just fill the bowl of the lens with saline, and have the patient lean over. You can put fluorescein on in the bowl and have them put it straight on, and that's all there is to it in the chair. Very simple. Have them look down towards the floor, and you can hold the upper lid, have the patient hold the lower lid, and just use the inserter, and it goes right on. It's really simple. If you should happen to see a bubble, bubbles always occur with the insertion process if it's going to happen. And so if you do see a big bubble like that, take the lens back out, put more solution in, put it back on. Within 1 or 2 or 3 times, this all goes away because you'll see how easy it is and how not to get a bubble under the lens. All right, let's talk about the determination of the key component right now, the vault. This is really important. Really what we want to do, I'm asking you to think about at the end, we want to clear the highest point, the apex, by 100 to 150 microns. That's all there is to it. How do we get there? You start out with the first lens at a 250 micron lens out of your diagnostic set in a flat skirt. Remember, flat skirt. And you just wait a few minutes and take a look at the fluorescein under that lens. You're going to see one of two things, right? You've got a cone here. You're either going to see clearance because that vault is over the top of the apex, or you're going to see a little touch, a little bearing. One of the two has to happen. So let's talk about, with that 250 lens, in both directions, what you're going to do to get the final result here of what vault that you want to be able to do a proper fit. Let's say the first thing that you see when you put on that 250 lens is that you see pooling. So you know you're already clearing with the 250 over the top of that apex. So what I'm going to suggest is we need to find out how much above that apex we are. So start going down by 100 micron units with diagnostic lenses. If you start with a 250 and you want to go down, you're going to pick out a 150, right? When you put that 150 on, you're going to see, again, one of two things. You're either still above the apex or you're going to be touching, one of the two. Once you go down and you do see touch, now you know you've accomplished it. You started out with clearance, you came down, and now I see touch. Now I know where that apex is at pretty well. But you came down in 100 steps. What I would suggest at this point is there's only one thing you have to do, and that's to take one more lens and adjust it by 50 microns just to see whether or not how hard you are pushing on that apex, how much bearing you've created. So when you're at that point, now add back 50 microns, and at that point, again, you're going to see one or two things. Either you're going to get it above the apex, or you're still going to have a little bit of bearing. So let's say when you put that 50 micron extra back on, you still see a little bit of bearing. That's fine. Now you know basically where you're at. I'm suggesting go ahead and use that vault, add 150 to it, and that'll be the vault that you'll use. Pretty simple. If you went back up by 50 microns and you saw pooling, well, you're already above that apex, so only add 100 and order it. Either way, I'm trying to get you to the 100 to 150 vault clearance, micron clearance, because at that point, I know you'll be successful. That lens is going to come down a little bit, so that's why the 100 to 150, so we allow for a little bit of settling and still be clearing that apex of that cornea. Make sense? Good. Let's go the other direction. Let's say you put that 250 on, and with that 250, you saw pooling, or you saw bearing, I'm sorry. So what do? I want to find out where the top of the apex of that cornea is. I start going up. Go up at 100 micron steps. As I go up until I clear it, until I see pooling. At that point, now I know I'm above it, at whatever vault that is. I have to refine it though. So at that point, we're going to do that one last little step called the defining step. Decrease that final vault by 50 microns. At that point, you're either going to be back down touching the cornea or you're still going to be clearing. Let's say you went back down and you're still clearing. You're done. All you do is add 100 microns to that lens that you have on right there, and that'll be the vault you're going to use. If you went down and you see a little touch, let's go ahead and increase it and order 150 more. Again, why? Because we're trying to get back to where either way we're about that 100 to 150 microns above the apex of that cornea. At that point, that final lens, before you take it off, you could do two things. You go ahead and do your overrefraction, and before you take it off, now at that last lens, look at how the skirt fluorescein pattern looks. This is a perfect representation of the fluorescein pattern that is fantastic. The lighter ring that you see right here is a light touch of that inner landing zone. That's the RGP touching of that inner landing zone. Just a nice and light touch on that cornea. It's not heavy bearing. You should see this pattern, where that soft lens is comfortably sitting on the cornea, that outer landing zone, the fluorescein ring where the junction's at, and then a very light feather touch of that inner landing zone. If you should see a pattern like this where at that final lens, that inner landing zone is just too much bearing. It's just, see, there isn't even any fluorescein in that inner ring. That's just a little bit too much. It'll still work, but it's not going to let quite enough tear exchange underneath that lens. So at that point, I would say, go ahead in this case and use the medium skirt. That medium skirt will just boost that up just a little bit, just enough to get better tear circulation out of that lens. We're not trying to use it to clear the apex, because we've already done that with the vaults. So we're just trying to add just a little bit tear circulation under there. And see, with the medium skirt, now you've got a nicer feather touch. But I'm going to tell you right now that this is only going to happen about 30% of the time. 70% of the time, you're going to be using the flat skirt. And compared to your clear cone, steep skirt, get steep skirt out of your mind. You're probably not going to be using that hardly at all, quite frankly. This lens, because of those wider landing zones, the internal and the external, together make a very, very, very comfortable lens for your patient. The clear cone really only sat in one area on the cornea, and that made it a little more sensation. This will be a very comfortable lens for you. Overrefraction. This is really key. Whenever I suggest you do that overrefraction, any time with any pair of lenses on while you're doing your fitting, if you want to do your overrefraction, go ahead and do it. Because quite frankly, for every vault, we've already optimized the power for that vault, and we've made it so that when you do one overrefraction, you don't have to do it again. Because you use your one overrefraction to add to the power of whatever vault that you're going to order, and that's all you do. So say you did an overrefraction, and you found a -2, and that was in a 2.5 vault. If you're going to use that 2.5 vault, you take the 2.5 vault, and it's in a -9 is that vault power. You add your -2 overrefraction, you order a -11. What if you said, well, wait a minute, before I order that, I think I'm going to go to a 300 vault. Fine, go to the 300 vault, its power is -6.5, you still add your -2, and you'd order it at -8.5. So again, you can do any vault you want and use the same overrefraction one time. It makes it really simple. And that's all you do. Order the vault, skirt, and power. And you're home free with an UltraHealth fit for your patient. I do want to make one point. Those of you, and I know there's some in the audience here that are fitting clear cone, you'll say, well, can I take a clear cone that's wearing a whatever power, medium skirt, in a 300 vault, and can I just order that in UltraHealth? You can't, because with UltraHealth, as we have changed that lift zone and we've created more room, we've also optimized the base curve, adjusted powers, so there's nothing similar from a clear cone parameters to the UltraHealth. So you cannot go from one to the other. So you're going to have to refit the UltraHealth, which is fantastic for the patient because they're going to feel the comfort and see the benefit of going to the UltraHealth. Where to start? It truly is, as you've seen, different from anything you've fit before. Very simple to fit, but different, including a difference from our SynergEyes KC or our clear cone. Commit to a learning curve. It's a little bit different. It's not going to take you long, though, as you 3 to 4 patient fits, and you'll feel like this is old time to you. Very straightforward fitting philosophy, but do give yourself a little extra time initially. any of these patients, your cones, the other irregular corneas, post-surgical, intacts, bigger ectasia, more displaced cones, all of these you're going to find success with our UltraHealth lens. You know, you may be challenged if you had a large pellucid cornea that out at the limbus area. That may be the challenge with UltraHealth. Everything else you're going to find a very high success rate. People wearing corneal RGPs that want better comfort, you can give them that RGP vision, but with a comfort of a soft lens. And of course, piggybacks, they work great, but they have their limitations. I think you'll find this lens to really be a vast improvement over piggyback structure. How about the lens handling and care? Both our UltraHealth and our Duet lenses, you take care of them the same. Insertion removal is in the booklets. It's very simple for the patient. By the way, getting these lenses out, the way we fit with flatter skirts, looser fit, they'll come out much easier. I know some of you said the clear cone sometimes is harder to get out for a patient. You're going to find much easier time for the patient to get these lenses out. As far as care and solutions, we really do suggest Clear Care hydrogen peroxide system. Boy, it gets the lenses really clean, disinfects them. So for our cone patients who we know wear them from the time they get up until they go to bed, they get a lot of junk on their contact lenses. This will really clean them up. They can use other multi-purpose solutions if they want to, but Clear Care is going to be what we would really recommend. If you have a patient that's really getting some buildup, have them use a daily cleaner. In fact, maybe all your patients in our Duet and our UltraHealth lens should be using a daily cleaner, because boy, that daily cleaner, even if there's alcohol in it, you can use it because it doesn't hurt the skirt. It's on for such a short period of time. Rinse it off, but it gets them super clean. And that's the biggest enemy of us, we all know as contact lens fitters, is having patients keep lenses clean. And our lenses are a 6-month lens. You get 2 pair a year for the patient, so they want to keep them clean so they don't run into other problems with just discomfort because of dirty lenses. And that's UltraHealth. We're very excited about it. We think you're going to be really happy with the lens, and I know your patients will be really happy with the lens. Thank you. Thanks for coming. Appreciate it.